This meeting is now being recorded.
Great. So just a couple of housekeeping items per usual. So I think everyone's been able to get on just fine today. As you just heard, I'm recording the webinar, so we will have that available if you want to go back and re-listen to any part, or if someone on your staff wants to listen to it at a later time. Usually we have the recordings available in about 24 hours, so I'll send out an email with instructions when I have that. Right now you should be seeing a tree or an outdoor background. When each presentation begins, we'll pull those up and you should see them just fine. I've gone ahead and muted everyone in case you're typing any notes or someone pops into your office. So if you do have a question, please use the Q&A button, which you can see up in the rightish corner. It looks like two chat bubbles. One is orange and one is gray, and it says Q&A below it. If you click on that, you can really easily type in a question. You can also use the public chat function, which you can find in the lower left. I am so excited to introduce Cassie Brooks, who is from the Chicago Housing Authority. She is taking over as the Education Working Group Coordinator. You may remember that Courtney Cameron from the Seattle Housing Authority was previously in this position. Very excited to have Cassie join us. I know she's going to do a great job. If you haven't met her or spoken to her, I'm sure she would love to chat over the phone, or you can send her an email. I can send out her contact information. But she is excited to be in this role, and she may say a few more words in a moment about it. But certainly, please let her or myself know if you have any questions after the presentation, or if you had any technical problems, so we can make sure to get that resolved for you. I also want to just take a quick plug. All of you should have received an email about a month ago with our Affordable Housing and Education Action Agenda. This was a result of a lot of the hard work that you all have been doing this year, as well as other CLPHA members, and the summit and symposium that we had in February and in March. So if you need to get that copy again, please let me know. I'd be happy to send it to you. And we would really love to have, if your housing authority hasn't already signed on, we'd love to do that. Signing on at this point just shows your support, doesn't commit you to anything beyond that. And of course, CLPHA will continue to support you in any way that we can with this education effort. Lastly, our next webinar is on July 21st. As always, it is the second to last Tuesday of the month. It's going to be focusing on high student turnover. It will take place at 2 p.m. Eastern Time. So if you're interested in presenting about that, any special initiatives your agency might have taken to address high student turnover, maybe churn from students experiencing homelessness or other reasons that they might be changing schools a lot, please let me know. We'd love to have you present. So with that, I am going to give it over to Cassie.
Great. Thanks, Abra. This is Cassie Brooks. I am from the Chicago Housing Authority, and I'm very excited to be the new working group coordinator for this session. For those of you that don't know me, I am the education specialist here at CHA for our resident services team. So all the topics always seem very, very timely and core to my work, as I know a lot of them do to your works as well. So I'm happy to reach out and talk about those initiatives that we're doing, and also hear more about yours anytime. So feel free to reach out to me. I'm really excited about the panels we've got today. We have first, we're going to hear from Robin Roberts about parents as teachers. In our prep for this session, we decided that it would be best to have her join us first and present sort of an overview of the program, and then we'll hear later in the hour from Akron Housing Authority about how it's implemented, or how that model can be implemented on the ground. So that's about it from me, and I'm going to turn it over to Robin. Again, if you have any questions, use the Q&A or the public chat, and I will help facilitate those questions being answered towards the end of her presentation. So Robin, are you on?
I'm here.
All right.
We appreciate it. Good afternoon. I want to begin by thanking you all for this opportunity to present Parents as Teachers today. As I share with you our vision and mission statements and our goals and outcomes, as well as our approach to working with families and young children, I'm hoping that you're going to see how our organization aligns with the vision and the action agenda of the Council on Large Public Housing Authorities. and also how we can partner to positively impact our children and build stronger families as well as stronger communities. I want to begin with a powerful word from James Heckman. He's one of the leading economists of our time. We're all aware that it's not just the educators that are preaching the importance of early childhood now, but those that understand the human factor in a strong and healthy economy are doing so as well. Brain research has demonstrated the importance of the earliest years as they relate to lifelong learning and success, and research has further proven that parents are the most influential factor in providing a nurturing, engaging, and safe environment that supports development in all areas. And it's this early development that lays the foundation for continued learning throughout life. If that foundation is not there, not only is it difficult for a child to learn more difficult concepts as they grow, they may have actually completely missed the opportunities for some learning, which can negatively impact their trajectory in life as well as in school. And as Dr. Heckman points out, parent education is a critical component to making sure our children are successful. Parenting challenges are common among all demographics, but they're particularly challenging among vulnerable populations, often work long hours, and they may not have had as many positive parenting experiences from which to draw. So parents as teachers provides the support, coaching, and mentoring to empower parents to provide the best opportunities for their children to learn and to grow and develop. So the vision of parents as teachers is that all children will learn, grow, and develop to reach their full potential. And we emphasize all because our core values state that all young children and their families deserve the same opportunities to succeed, regardless of any demographic, geographic, or economic considerations, and that an understanding and appreciation of diverse cultures is essential. And so our mission to make this vision a reality is to provide the information, support, and encouragement parents need to help their children develop optimally during the crucial early years of life. And this mission stems from our core values as well. Those core values state that parents are their child's first and most influential teachers, and that the early years of a child's life are critical for optimal development and provide the foundation for success in school and life. We also hold fast to the core values of the information that we share, and the practices that we incorporate in our approach with families is based on established and emerging research. So we have 4 goals in parents as teachers. We want to increase parent knowledge through parenting practices, increase school readiness and school success, provide early detection of developmental delays and health issues, and to prevent child abuse and neglect. All of these goals support our long-term outcomes of strong communities, thriving families, and children who are healthy, safe, and ready to learn. Independent evaluations have been integral to the success of parents as teachers since its inception. Research has been conducted and supported by state governments, independent school districts, private foundations, universities, and research organizations, and outcome data have been collected from more than 16,000 children and families. Evidence of effectiveness of the PAT model has been supported by rigorous research designs, including randomized controlled trials and quasi-experimental methods. Studies published in peer-reviewed journals have shown statistically significant effects, demonstrating that PAT achieves its goals and makes a real difference in the lives of children and families. And with each new evaluation, we continue to learn about the children and families served by parents as teachers and the long-term impacts on communities. And so here are some of our outcomes that have been demonstrated through research. Parents as teachers' parents showed significant improvements in parenting knowledge, parenting behavior, and parenting attitudes. And teen mothers have shown greater improvement in knowledge about discipline and have organized their home environment in more appropriate ways. Approximately 23,000 children every year are newly identified with a developmental delay or problems with vision, hearing, or health, and that's including mental health. And parents and teachers' children were 5 times more likely to be fully immunized. Parents and teachers' children were also less likely to be treated for injury, and PAT participation was related to 50% fewer cases of suspected abuse and or neglect. And parents and teachers' children have scored higher on measures of achievement, language ability, social development, persistence in task mastery, and other cognitive abilities. Parents and teachers combined with quality preschool education has reduced the achievement gap between low-income and more advantaged children at kindergarten entry. More than 75% of the low-income children who participate in PAT in preschool were rated by their teachers as ready for kindergarten in one study. Teachers rated parents of teachers' children significantly higher than non-PAT children on multiple developmental indicators of school readiness, which included emotional well-being, fine motor skills, expressive language, receptive language, and social competence. And parents of teachers' families with very low income were more likely to read aloud to their children, to tell stories, say nursery rhymes, and sing with their children. Over 75% of parents reported taking their children to the library regularly and modeling enjoyment of reading and writing. And parents engaged in more language and were more likely to promote reading in the home. And so some of the outcomes that we've looked at have actually extended even into the elementary grades. Parents of teachers' parents were more likely to enroll their children in preschool, attended parent-teacher conferences and PTA and PTO meetings and school events, to volunteer in the classroom, to talk with their children's teacher and assist with their children's homework. In one study, 63% of parents of teachers' parents versus 37% of non-PAT parents actually requested parent-teacher conferences. And the PAT children scored higher on standardized measures of reading, math, and language in the elementary grades. Compared to non-PAT children, parents of teachers' kids required half the rate of remedial and special education placements in third grade. One particular study conducted by Dr. Edward Ziegler and Judy Pfannenstiel looked at parents of teachers and its impact on school readiness. They released their findings in an article that was published in the Journal of Primary Prevention in 2008. More than 7,700 Missouri students were included in the research over a 3-year period, and poverty was based on the free or reduced lunch level. In this study, Dr. Ziegler found that participation in parents of teachers programs predicts children's school readiness and third-grade achievement regardless of income level. This slide shows the percentage of children entering kindergarten ready by poverty status and pre-K experiences. When children in poverty receive parents of teacher services for at least 2 years, along with preschool for 1 year, the achievement gap normally observed between children in poverty and more affluent children was virtually eliminated at kindergarten entry, with more than 75% of the low-income children who participated in PAT and preschool rated by their teachers as ready for kindergarten. And in a follow-up study, it was discovered that the gap continued to narrow even into third grade. The parents as teachers provides families with information, resources, and tools through 4 model components that are designed to help young children learn, grow, and develop. The first is personal visits. Personal visits offer parent support and information to empower parents to make good parenting decisions. Individualized, strengths-based visits focus on child development, parent-child interactions, and family well-being. The second is group connections, which provides opportunities to build a sense of community. Parents come together to share experiences, discuss problems, learn from and support one another, observe their children with other children, and practice parenting skills. In addition, child development and parenting information is shared, and social connections between parents are fostered. The third component is screenings. Screenings ensure children are healthy, safe, and ready to learn. Annual screenings are offered to help parents understand their child's development, recognize strengths, and identify areas of concern that might suggest the need for follow-up services. And then referrals connect parents with a network of community resources that meets their family's needs. We believe that it's essential that programs build comprehensive, collaborative, and community-based partnerships that build on family strengths, support long-term self-sufficiency, and impact real and long-lasting change. So the parents and teachers approach to working with families involves 3 roles: partnering, facilitating, and reflecting. As partners, parent educators relinquish the role of expert, and they enter a relationship where everyone is invested in the children. And as facilitators, parent educators work to gain the parents' perspectives and provide objective research-based information to support the family's decision-making. As reflectors, parent educators use evidence-based practice to prompt reflection, generate awareness, and support growth. By incorporating these 3 roles into interactions with families, parent educators begin to create a relationship of shared ownership, knowledge, and power. It is this relationship that empowers parents to take responsibility for their own growth and learning. And the practices included under these three roles have been proven by the best available research and recognized by our field to increase a parent's level of engagement, to promote parenting that fosters children's early development, to motivate a commitment to parental growth and behavior change, and to improve parents' abilities to discover their connection to their child's behavior and their family's well-being. Research-based and evidence-informed are two terms that we hear in relation to quality home visitation. And our core value states that information we share with parents should be research-based, and the practices that we use in our approach to working with families should be evidence-informed. A compilation of over 2,500 pages of parent-child activities, parent handouts, and resources for the parent educator can be found in the PAT Foundation curricula. And these are designed to help trained parent educators identify and build on family strengths, their capabilities and skills, and protective factors within the family. Parent educators use the foundational curriculum and the plans within that curriculum for their personal visits to intentionally introduce core parenting knowledge, to grow the skills of the parents as well as themselves in partnering, facilitating, and reflecting, and to provide a transition into shared decision-making and planning with the family. So a little bit of background about who we are. The concept for parents as teachers was developed in the 1970s when Missouri educators noted that children were beginning kindergarten with varying levels of school readiness. Research showed that greater parental involvement was a critical link in the child's development of learning skills, including reading and writing. The early childhood professionals suggested that a program to provide early detection of developmental delays and health issues and parent education to help parents understand their role in encouraging their child's development from the beginning could help improve school readiness and parent development. With funding from the Missouri Department of Elementary and Secondary Education and the Danforth Foundation, Parents as Teachers began in 1981 in Missouri as a pilot project for first-time parents of newborns. Recognizing the program's benefits and cost-effectiveness, the Missouri legislature provided state funding in 1985 to implement Parents as Teachers programs in all Missouri school districts. Since 1985, Parents as Teachers has expanded to all 50 states, 100 Native American tribal communities, and 6 other countries. Parents as Teachers is now a worldwide leader in the delivery of evidence-based home visiting and parent engagement tools that demonstrate successful results in school readiness and health and the development of young children. Nationally and internationally, PAT is implemented in a variety of organizational contexts, including education, health, mental health, and other social services. But some of our best partners are housing communities that realize how parenting education and engagement can strengthen a community. We share a common goal to help parents engage with their children in ways that lead to a lifetime of good health, educational achievement, and future success. Parents and Teachers services are funded by a variety of federal and state governments, local school districts, and private grants. Our Housing Authority partners fund PAT through a combination of funding sources, including Hope 6 grants, TANF dollars, state home visiting funds, federal McVie dollars, private foundations, United Way, and individual donations. Currently, Parents as Teachers is offered in these public housing authority locations. Each is unique in its approach and in its funding, and most of these involve a partnership between the Housing Authority, other housing providers, and other nonprofit or government agencies, including school districts. For some, parenting education services are a natural part of wraparound services that may include after-school programs, food pantries, job training, or ESL classes. So why Parents as Teachers? And what does Parents as Teachers have to offer housing developers? Well, other than some of the information that I've just shared with you around the fact that we are a leader in the early childhood education arena, that we have demonstrated positive outcomes for children and families, and that we have successfully partnered with a wide range of local and national family-serving organizations, including housing authorities. There are some other reasons that have been shared just by some of our housing. One, services take place where families live, and this minimizes logistical challenges. Place-based services reduce costs of delivering services since the parent educators who visit families in their homes are located on site. There's a potential for tax credits and the extra points that come with high-quality services. Easier recruitment to prospective residents and reduced turnover. One site reported less vandalism, repair, maintenance as parents became more involved and attentive to their children. And we have a quote from one of our partners who said, affordable housing residents care deeply about the same things middle and upper income parents care about, their children. Having a Parents as Teachers program on site is confirmation that our housing authority also cares about their children and puts us on a more positive footing with tenants. Tenants who participate in Parents as Teachers understand the importance of their children succeeding in school and see Parents as Teachers as a means to this end. The Parents as Teachers have signed on to the Affordable Housing and Education Action Agenda because we see potential for a strong partnership. Together, our voices, resources, and common vision really can propel us forward in our work to strengthen families and creating strong communities. Our goal is to help parents engage with their children in ways that lead to a lifetime of good health, educational achievement, and future success. And so we invite you to join us in this effort. So how can we get started? How can you begin to partner with Parents as Teachers? Well, there are two places on our website where you can find out where Parents as Teachers programs are located in your community or in your state. We have a program locator, as you can see there, if you go to our main website and go to a location tab. But then also, many states have what we call state leaders. We have state offices. And in those states, if you're able to contact your state office, they can help you to locate the closest community or where there may be some similar partnerships happening within your state. If you have further questions about Parents as Teachers, about the research, about the benefits of PAT in communities and how we can partner with you or with other housing authorities, please feel free to contact me or Daryl Rothman, who is our Director of Partnerships and Business Innovations. And so that is our information that we want to share with you today. And so if you have some questions, we'd be glad to answer those.
Sure. I'm not seeing questions in the chat or on the Q&A. If you have any questions, now would be a great time to add those. We may have some more questions as we see how the program is actually implemented on the ground in Akron. But if there are any questions, feel free to put them in the box now, and we'll ask them. All right, and if not, then we want to thank you so much, Robin, for joining us. Again, we may have some additional questions as we start to see what the model looks like for an individual housing authority. If we can have Rochelle and Chris from Akron, they're going to tell us a little more about how their program looks down in Akron. You guys there?
There we go.
There we go.
Thank you so much, Cassie. This is Rochelle Wardell in Akron, Ohio with the Akron Metropolitan Housing Authority, and I'm joined by my colleague Chris Uhas, who is our Director of Strategic Engagement here. And today we're going to share with you guys what we're doing with early childhood in Akron, which include our Early Childhood Initiative, where we do use the Parents as Teachers curriculum, and also about our Reach Opportunity Center at Summit Lake, where we have a dual generation approach to learning. So first we'll talk about our Early Childhood Initiative, which is we focus on preventative action and exposing families to other services in Summit County that will help to prepare children for school and to advance self-sufficiency among families. And why did we go into early childhood? I was going to talk to you a bit about research, but since Robin covered a lot of that, I won't do that, but we do know that later remediation will not give the same effects as interventions in early childhood, and we saw that as an opportunity to help not just our residents, but to advance our community as a whole. With nearly 10,000 kids in Summit County living in our housing, we saw this as a great 10%. Did I say 10,000? 10% of the kids under 5 in Summit County live in our housing, so we saw that as a great opportunity. And of course, we've seen different studies showing returns on investment up to $17 in some cases. So Our Early Childhood Initiative has three components. The one being Parents as Teachers, where we provide home visitation to support child development and the families as a whole. Those visits happen either 1 or 2 times a month with families, depending on the family's level of risk. We target families prenatal to kindergarten entry. We provide referrals, encourage self-sufficiency, and also do assessments on children to try to catch developmental and health delays. We also, the second component, are family outreach events, which are these group connections that Robin was talking about, where we provide an engaging theme to bring families together to foster a sense of community around early childhood, and we have many community partners come to those events in order to gain exposure to the families that we serve. Some examples of community partners that come to our events are Head Start, the local public schools and kindergartens. We have had nursing students from the local universities come to talk about asthma and other health issues. But we always, like I said, have an engaging theme. So we just wrapped up our school readiness events where we had Jungle Terry come in, and he brings lots of animals for the children to touch and learn about. But the real reason we wanted everyone to come together was to promote kindergarten registration. So the schools came and were able to on-site register kids fully for kindergarten. We were able to get over 20 kids to register already for next fall. So we really work hard with our partners through these events to make sure that they are gaining exposure, recruiting, and that our families are able to see everything that's out there for them. The third component that we have is a maternal depression program, and we have groups that we call Mommy Time. We collaborate with 2 organizations here in Summit County. One is called Child Guidance and Family Solutions. It's a behavioral health organization, and also the Akron area YMCA. Child Guidance and Family Solutions comes in, and they actually facilitate a support group for the moms, while the Y helps us with child care while the moms are in group. And we're, as I will show you later, we're seeing really good results out of that program. We feel that Parents as Teachers is really great for our families because while there are many programs out there that help kids to get ready for school, there are often eligibility issues, and there aren't a lot of programs for 0 to 3s. And we see Parents as Teachers for those folks without diagnosis, for example, as a good continuum until there are more things available to them when they're closer to preschool age. Another reason we like to do Parents as Teachers in the Early Childhood Initiative from within the Housing Authority is that we're serving a very hard-to-reach population. And with access to the Housing Authority's database, we're able to reach the people very rapidly. We have a welcome wagon set up that we've put together where within the first 30 days we're visiting new families to our Housing Authority and taking along some swag and books and rattles and things to the family and let them know about the Early Childhood Initiative and hopefully get started as soon as they enter our doors. Also, we will, if a property manager has, if they request through Resident Services to help a family with furniture, let's say, and that family has a 0 to 5 in the family, we'll send one of our early childhood staff out, and that way they can take care of the family's needs and also encourage them to participate in our program. And then our family outreach events also have a cyclical purpose. We use them as the group session requirements for Parents as Teachers, but it also helps us to recruit people to participate in our home visitation services. As far as staffing goes for the initiative, we have 4 full-time field staff that do the home visiting and service coordination for our families. and they also coordinate our family outreach events and staff the Mommy Time. And they also do community engagement. We have a local early childhood systems organization in Summit County, and we have one of our staff represented on every subcommittee of that organization so that we are making sure that we're contributing to the community's initiative as a whole. And then the next three people that you see on this slide here, they are full-time employees of the Housing Authority, but their efforts toward the Early Childhood Initiative are just on a part-time basis. We have a Parents and Teachers Supervisor who handles data and compliance and administrative things for the initiative, and we have a manager who focuses on fundraising, program coordination, forming new partnerships in the community, and then our Director of Strategic Engagement who handles the big picture things and connects the dots in the community and helps steer the initiative forward. As far as our how the load of work that we do, we served 970 individuals last program year. We average about 80 parents and teachers visits per month. We held 46 maternal depression support groups, and on average about 31 people come to those groups a month. And we held 39 family outreach events with an average attendance of 54, and about 12 different community partners participated in those events. As far as our evaluation goes, our goals align with the goals of parents as teachers with the addition of some goals around maternal depression. We've found that ECI builds confidence among our parents. 91% of parents at post-test say that they know how to help their child learn. Actually, let me retreat there a little bit. 91% of parents score above the intake average at post-test on the measure of I know how to help my child learn. We've also found that dosage matters. If a family is meeting the dosage requirements that parents as teachers put in place, they're 26% more likely to show increased engagement with their children than the folks that we meet with that do not meet the dosage requirement. We also work very hard to provide referrals for, we also work very hard to provide referrals to not just early childhood, but anything to help support the family and promote self-sufficiency. But as far as early childhood referrals go, we did make about 150 last year, and 62% of those referrals resulted in enrollment. And then finally, Mommy Time, the maternal depression support groups, is showing to make a difference in women's lives. We see that about 46% of moms who come in to our support groups are showing possible signs of depression. And of those women who come back enough times for reassessment, those that are showing signs of depression at intake, about a third of them by their third session are showing signs of improvement. And then finally, I don't have here on the slide, but I did want to mention that just this year we have found we've been able to catch about 17 children with potential delays, developmental delays, and to which we then refer to make sure those kids are taken care of before they hit the school system. Finally, I want to talk about how we fund the Early Childhood Initiative. We do not receive any federal funding. It does not come from HUD. We do a lot of local fundraising here. We have about 67% of what we do comes from our local community. 14% of it comes from a state grant called the Ohio Children's Trust Fund. 11% of our funding comes from the United Way, and about 8% of it is earned income, and that comes from another housing organization here in Summit County that is not operated by the Housing Authority. They actually pay us to provide our early childhood initiative at their site. So with that, I'm going to turn it over to Chris Uhas, who's going to talk to you about our Reach Opportunity Center.
Good afternoon, everybody. I just wanted to tell you, because this is sort of an outgrowth of the Early Childhood Initiative. We did this for a few years and had the opportunity to apply for, and some of you may remember, the Capital Fund Education and Training Facilities Program grant that HUD offered about 4.5 years ago. And we were the successful recipient. We were actually the 4th largest award in the country in that round of grants. And what we wanted to do was to take our Early Childhood Initiative and be able to go beyond just AMHA and into an impoverished neighborhood. The one we chose is the median income is only about $15,500. So they definitely need some help in that neighborhood. There are lots of other statistics. I know it's about 27% that don't have high school diplomas and about 22% that are unemployed. So it's really a neighborhood that needs help. But it is an educational facility with services that span from birth to adult. We really like to think of it as a cradle-to-career model. The center does help families to rise above poverty by providing a comprehensive system of education, training, support, and resources that are keys to improving personal opportunities and achieving self-sufficiency. Now, the mission of the Reach Opportunity Center, and I will back up just a minute, because in order to prepare for this grant, we had to identify who our partners would be, what services would be provided in the center, et cetera. We knew that what we needed to do was, the grant said, was early childhood, adult learning, and job training. So we did work with others in the community to decide, what programs would be most beneficial to the residents of that neighborhood and which ones would be most needed and have the best outcomes for our community. We actually pulled our partners together, and after we received notification that we got the grant, and through a local foundation, we were given a $75,000 capacity building grant to pull all these partners together and decide how we could collectively impact this neighborhood. We knew Head Start worked. We know Parents as Teachers works. We knew a lot of these programs on their own were great, but how were we going to collectively impact this neighborhood and these families and these residents? So we came up with a mission of the Reach Opportunity Center to enhance the quality of life for the residents of Summit Lake by increasing educational opportunities through the collaboration of community partners. Our goals that we came up with collectively were to improve academic success for children of the neighborhood, boost academic achievement for adults of the Summit Lake neighborhood, prepare job-seeking adults in Summit Lake for the job market, and to encourage family self-sufficiency in Summit Lake residents. The grant that we received was a $4 million competitive grant that I told you about earlier. AMHA was required to provide a 20% match, so we paid about $800,000. Akron Public Schools, which have 2 kindergarten classrooms in the center, actually had to pay for their part of the building, which was about $500,000. So the whole project was a $5.3 million facility. Then the City of Akron actually provided AMHA with a 99-year ground lease for $1 for the land that this Reach Center occupies. So we did not have to pay for land other than that $1 that we pay every year. What's happened from all of this, and we just, I should back up and tell you, we just opened last July. School just started this fall. So we don't have a lot of data, although evaluation component is huge. And again, as I told you, we're really evaluating the collective impact on this as well as the individual programs. So we have hired an evaluator to see what we're doing. I know from experience with early childhood that it takes the kids forever to go from birth to 5 so you can finally get any results. But at any rate, one of the things we're most proud of with this is that it really is an effective 2-generation approach. And I think for those of you who have seen research, I think there's more and more research that's supporting the notion that it's great to help the kids, it's great to help the parents, but the commitment to provide outcomes for children and parents simultaneously is really where you start seeing the needle moving. So we're committed to that, and we are committed, as I said before, to the whole cradle-to-career continuum. We also are looking at this as a model for the future. I may have met some of you when we were at the summit in Washington, D.C., but we were highlighted in a case study by the Urban Institute for our work with school districts and others in that collaboration to make this happen. And the Urban Institute did say to us later, this really can be a replicable model for what you're doing. So we're hoping that maybe we can replicate it here, maybe somebody else would want to try and replicate it, and we're certainly willing to give information on how we got to where we are. Also, the whole strategy of accessibility, we're bringing the services to the people who need it most. 32% of the folks in this neighborhood don't have transportation, so just like with parents as teachers and everything else, we are, having the services right where families need them most. And then the gifts of collaboration. Again, one of the reasons that HUD cited for us getting the grant, in addition to our experience with early childhood, is the whole idea that we have such a great partnerships with others. And the next slide will show you kind of what programs we have so you can understand the power of that collaboration and really the number of programs and services we're able to offer to that neighborhood. First of all, we've taken AMHA's Early Childhood Initiative, Parents as Teachers, Home Visitation, Family Outreach Events, and the Mommy Time Maternal Depression Program to the entire neighborhood. So we have 241 units of housing right next door to this facility of AMHA housing, but we actually touch the whole neighborhood, which is about 3,200 people who are in the boundaries of what we've defined as that neighborhood. We have 2 Head Start classes and 2 early Head Start classrooms. Total served with them is about 70 kiddos. The early Head Start, there's 1 infant room, there's a toddler room, and then there are 2 preschool classrooms with 3- and 4-year-olds. We also have the Incredible Years program that's offered by one of our partners. Some of you may be familiar with that, but that's really a behavioral health program working with the kids and also with the parents. The library provides a story time and ready-to-read program. And then the Spark program is a local program that has really achieved some great outcomes in kindergarten readiness, and we have partnered with them as well. For youth, we have, as I mentioned before, 2 Akron Public Schools kindergarten classrooms. And one of the reasons we did that is because we like the idea that we can be there for that transition from preschool to kindergarten. So that's a great commitment from our school district. We also have Boys and Girls Clubs who meet there. This is mostly elementary school kids. And then we have another program that's just recently been added called Students with a Goal. And this is a program for kids ages 12 to 18, where they come in and they play basketball in the building next to us, and then they go on to help with homework and things like that. Then for adults, we have computer literacy, resume writing, a program called Know Your Skills, where you just get an idea of what you're good at and what's realistic in your job search, preparing for an interview, financial literacy programs, GED prep, which we are doing a pilot program. Actually, Project Learn of Summit County is doing a project or a pilot program to train people for their GEDs, and at the same time using the Bridges Out of Poverty, Getting Ahead curriculum to help them figure out how, once they get their GED and additional training, how they can get out of poverty. Our Department of Job and Family Services has full services there, and we have our service coordination. So it's a great thing. We're really excited. We're also working with some local universities to provide additional programs that will actually train people for jobs that are really out there. We don't want to be in the habit of giving people a piece of paper just for the sake of giving them a piece of paper. We want to train them for jobs where there really are jobs. So that's pretty much it in a nutshell.
So now I guess we can open it up to questions if there are any questions. I saw a couple here about
Yeah, this is Cassie. It looks like we've got a couple from Maria in regards to questions. One of them I think was related to the participants in the program and seeing as the ECI is voluntary, what is their goal or incentive, or how are they? I saw some information on recruitment, but what is their, what's the hook for them to come and participate in this program or open their doors?
The Early Childhood Initiative is a voluntary program. And really, we found the hook are the home visitors themselves. They've done a really excellent job building rapport in some of our public housing neighborhoods. And I should have put this on our recruitment slide, but some of our best recruitment comes from word of mouth. And really, it's just a matter of the hook is that by working with the Early Childhood Initiative, your kid will have a leg up and you will be supported.
Great. And then I think the other question was related to the relationship between AMHA and the Summit Lake Center. How does that work? Are they?
Well, AMHA owns the building because AMHA received the grant. One of the things that we didn't mention is that about 4 years ago, AMHA formed a nonprofit subsidiary called Building for Tomorrow. So all our fundraising is done through Building for Tomorrow. There's no employees or anything like that, but we do use that as a way to apply for grants and solicit individual contributions. So there's that relationship there. It does get a little confusing. But with the Reach Opportunity Center, AMHA does own it, and we employ people. It's a separate budget for the Reach Center. We're actually in the middle of, HUD, I'm sure you all can understand, it was wonderful that we got this grant. But the good news was we got the grant, and the bad news was we got the grant because all of a sudden we realized we're going to have this beautiful building and absolutely not one penny to be able to pay staff or keep the lights on or maintain it or anything else. So we're in the middle of a $1.5 million sustainability campaign to raise money for endowment and operations to support the services and everything at Reach and operations.
And I actually have a couple of questions too. So does the Reach Center then also serve the surrounding community or just specifically the public housing development?
It serves both. It serves both. So it is that community, but it is one of our largest family developments, so we do have 241 units of AMHA housing sitting right next door.
That's great. Any other questions from the group for either our representatives from Akron or from Parents as Teachers?
Yeah, so I also just wanted to jump in. I know Robin addressed some of this with her presentation about Parents as Teachers. Rochelle, I don't know, do you all have some more sort of like long-term, I know this is a newer, in relatively speaking, but a newer program, but do you have any more statistics or anything like that about the effects, more long-term effects for children and families that participate in these programs?
So this year we will have our first cohort of children who we've served with Parents as Teachers going into kindergarten. So we will have that information probably next year. And this year we also participated in what our community calls the Transitional Skills Summary, which is an assessment to see if a child is ready for kindergarten. And with that assessment, a local organization called Summit Education Initiative puts together a packet of things that the parent can work on with their child if they are falling behind in any areas. And we just participated for our first year in that program, so we should be getting those results soon. But as far as long-term, we don't. We just have those interim indicators, which I shared with you.
Great.
But the nice thing about using Parents as Teachers is that Parents as Teachers is an evidence-based program, and if we are following Parents as Teachers to fidelity, which we do, then we know we should be getting those results that will come along with it. And also with the evidence-based, I meant to mention that also helps a lot in gaining funding by telling local foundations and others that we're using evidence-based Parents as Teachers. They're much more likely to come on board with us and support us for the long term.
Great. Well, as Kathy said, if you do have any remaining questions, please go ahead and type those either in the public chat or through Q&A right now. While people are just taking maybe a couple of minutes to formulate any last thoughts, I just want to, one more reminder that the next webinar is July 21st regarding high student turnover. It'll be at our normal time, 2 p.m. Eastern time. So if you're interested in presenting, please send me or Kathy an email. And Kathy, can you just tell everyone, I'll send it out, but can you also just tell them right now your email?
Sure. My email is cbrooks@thechha.org. So, yeah, happy to help facilitate in any of those ways. So, great.
Your zero is not. So I just entered our phone numbers. There should be a 0330 is our area code. I failed to include a slide with our contact information, but please feel free to contact us if you have any questions.
And yeah, just a reminder that I'm recording this. We will have, as soon as that recording is available, I'll send instructions to the entire group. So if you want to go back, the presentations will also be up in our Google Drive. And I will make sure to send out contact information for everyone. So if you do want to connect via phone or email with the presenters, you'll have that information available. Well, I don't know that we have any more questions. If you think of something later, please feel free to send it to me or to any of the presenters individually. I'm sure they'd be happy to follow up with you. Thank you so much to our presenters and to everyone who joined us today. I hope that this was useful and helpful.
Thank you so much for including us.
Thanks.